So, pulmonary embolism. What is it? How does it happen? And how do we treat it? Okay, so I know all of this probably just looks a little overwhelming, so let's break it down. Pulmonary embolism. How does it start? How does it start? God, sorry. How does it start? So, first we have something called a thrombus. What is a thrombus? A thrombus is when our clot is attached to these artery walls right here, and it's not moving, it's stuck. When it breaks, it turns into an embolus. An embolus then travels. So this right here is the embolus. It's traveling up this inferior vena cava, right? And it's going into the right atrium, the right side of our heart. When that happens, let's go ahead and take a look at this right here. This is the right atrium. Now, when we go into the right atrium, we then travel into the right ventricle. Where does the right ventricle lead to? The right ventricle then leads into the pulmonary artery, right? And that pulmonary artery then goes into the lung. This blood, all right here, all this blood is going through the inferior vena cava, and veins carry deoxygenated blood to get reoxygenated inside the lungs, right? Inside those capillaries. Now what happens? These capillaries are super small, okay? And so what happens is when we get into space so small, right here, right? It's gonna get stuck. What now? Now we have an embolism. So now that it's an embolism, what's gonna happen? I guess that's okay represented. Whatever. Anyways, now that it's an embolism, it's stuck inside the lung. What's gonna happen? So some things that are gonna happen is that we're gonna see sweating, dizziness, possible leg pain from what we once had a thrombus, irregular heartbeat, shortness of breath. Some things I would add to this is tachycardia, right? A low SpO2. What else? I would say that's a low SpO2, which means anything under 40, right? Bro, sorry, anything under 94. Oh my god, 94%. So some risk factors, some things that can cause this are, the main ones are smoking, prolonged immobility, cancer, pretty much all of these. But the ones that you'll hear about a lot in EMT class is smoking, heart disease, prolonged immobility, pregnancy, and cancer, surgery. Injury, supplemental estrogen, those things we don't really talk about. COVID-19. Just relating to the EMT course. So now, pulmonary embolism is very, very hard to catch. And one thing that can lead you in on a test question or in the field is if they have one of these, right? If they have one of these risk factors, okay? Let's say it's a smoker. And then one of these. Let's say they have a heart rate of 140. If they have one of these and these symptoms, if they have all of these symptoms, not just one, if they have all of these symptoms, then that will clue you in on a pulmonary embolism.